Hello, and thank you for watching this video on the safe and effective use of procedural sedation. This is your first step to becoming approved within your facility to administer moderate sedation for procedures. Patients that are sedated for procedures are provided a uniform and safe standard of care through an intake, sedation, monitoring, and disposition discharge system that's operated in an environment designed and supplied to make the sedation and procedures safe by providers who are properly trained and qualified. This course is your first step in becoming properly trained, qualified, and approved to administer sedation for procedures that require it.
The purpose of the online course is to go over the fundamentals, knowledge, assessment tools required to give safe, moderate sedation. To achieve that goal, we'll be going over a number of factors, including assessment skills, documentation, protocols, medications, airway skills, and recovery of the patients that undergo moderate sedation.
The system has created this course for the benefit of practitioners who sedate patients for procedures. It is designed to give them a consistent approach and the necessary materials for understanding the complexity of sedation and why we must work together to create an environment that's safe for the patients and for the procedure to occur. John Snow made a pithy observation about sedation. He said that ether provides benefits beyond anesthesia. It keeps patients still who otherwise would not be. And for some time, the ability to keep patients motionless during critical procedures was also considered of benefit. The benefits of sedation, however, must be considered within the context of the risks. Sporadic reports of bad outcomes, including brain injury and death, especially in children, prompted the American Academy of Pediatrics to promulgate guidelines for the patient assessment and care. This occurred in the early 1990s. The American Society of Anesthesiologists and its component Pediatric Society joined with the American Academy of Pediatrics in the mid-90s to further define those recommendations. This prompted the Joint Commission to publish standards for the care of patients being sedated in the late 1990s. And these standards have gone through revisions and refinements to form the framework of what we do to enhance both patient comfort and safety.
For as long as we've been doing painful procedures or procedures that cause anxiety, practitioners have been doing moderate sedation. However, recently we've come to see an explosion of procedures outside of the operating room as we develop new modern techniques. And more we're finding that practitioners are having to give moderate sedation in today's medicine. Over the years, it's become obvious that non-anesthesia providers can provide safe, moderate sedation as long as there is a protocol in their institution that can assure that practitioners have a given knowledge base and skill set to do it safely.
Especially, let's say, in a physician's office, when we give sedation, we should make believe it's an operating room. And we should follow all the rules of an operating room in terms of patient safety. And the idea is that, again, is to make sure that we communicate appropriately. So when we do the sedation, even if it's, let's say, it's an endoscopy, you should make sure that if it's a physician or anesthesiologist, whoever administers the conscious sedation, should ask the right questions in terms of making sure we're doing the right procedure, making sure that identify the right patient. The same question as we ask in the operating room, we should ask, is the medication ready? Is it the appropriate anesthesia? And so on. So all of these should take place as if it's an operating room.
The protocol should guarantee that a practitioner has a good fund of knowledge of the medications they're going to use, that they have basic airway recovery skills, that they have resources in the institution for monitoring and recovery to be able to deal with any possible outcomes that might surprise a practitioner even during moderate sedation.
This presentation is designed to follow the process of a sedating event from patient assessment, facility preparation, medication administration, patient monitoring during the procedure, and recovery from discharge to disposition. After participating in this activity, participants should be able to identify the anatomic, physiologic, and pathophysiologic considerations associated with the moderate sedation to ensure safe patient care. Recognize and effectively manage patients experiencing respiratory insufficiency, airway obstruction, and/or hemodynamic changes to reduce untoward patient reactions. Recall the appropriate patient selection, monitoring equipment, and personnel that must be present in an area in which a patient is sedated, and the required documentation for record keeping. Recognize the uses and side effects of commonly used sedatives, anxiolytics, and other medications when administered alone and in combination for moderate sedation, and participate in data gathering and performance improvement initiatives.
Following this video course, you'll be asked to take a 20-question post-test to demonstrate that you participated in the program. After you complete the test, the software program will grade it and automatically email proof that you passed it to the appropriate parties. If you fail the test, you'll need to review the course and retake the test until a passing grade is achieved. The post-test and your evaluation of the program will also serve as the mechanism by which you can receive continuing medical or continuing nursing education credit. Joint Commission standards clearly define 4 distinct levels of sedation and anesthesia. The first level is called minimal sedation, or anxiolysis, where medications are given in small amounts, often orally, to relieve anxiety. Patients remain fully responsive to verbal commands.
Judith, open your eyes, way up wide. Take a deep, deep breath, Blow it away, one more, good deep breath. That's good. Are you okay? Yeah, great. Good, everything's fine.
While you may see impairment of cognitive function or coordination, the ventilatory and cardiovascular functions are unaffected. The second level is moderate sedation, or conscious sedation. Moderate sedation is a level of sedation and responsiveness we are seeking, that is, the target state. With moderate sedation, the patient no longer responds normally to verbal commands, but the patient will respond purposefully to verbal commands, and sometimes the command itself is enough to make the patient respond.
Judith, take a deep breath for me. Deep breath. Judith, wake up. Deep breath here. Deep breath. Oh, perfect. Take another good deep breath. Oh, that's just great. You're doing fine.
And other times, the command will need to be accompanied by light touch stimulation. The third level of sedation is deep sedation, which is similar to moderate sedation in that it is a drug-induced depression of consciousness, but different in that the patient cannot be easily aroused. The patient will respond with purpose following repeated or painful stimulation.
Judith, take a deep breath for me. Deep breath. Judith, come on. Pat, get the Ambu bag.
The patient's ability to independently maintain ventilatory function may very well be impaired in deep sedation, and the patient may also require assistance in maintaining a patent airway beyond spontaneous ventilation. Cardiovascular function is usually maintained during deep sedation.
This course is mainly intended to credential practitioners seeking to achieve moderate sedation with their patients. To do deep sedation, you always have to prepare for the possibility that a patient is going to enter a plane of general anesthesia. The skill sets required to recover patients from general anesthesia are much more advanced than one we would expect from people doing moderate sedation. In particular, they include things like advanced airway skills, the use of fiber optic bronchoscopy, laryngeal mask airways, and also understanding the hemodynamic effects of some of the medications in the planes of general anesthesia, which would require a very broad library of understanding of recovery medications, which we typically wouldn't expect people looking to do moderate sedation to be familiar with.
The fourth and final level is anesthesia, meaning general anesthesia. General anesthesia is defined as a drug-induced loss of consciousness during which the patient cannot be aroused, even by painful stimulation. The patient's ability to independently maintain ventilatory function is very likely to be impaired, so the patient often requires assistance in maintaining a patent airway with or without an artificial airway and supported or controlled respiration. Cardiovascular function may be impaired. For the purpose of this discussion, anesthesia does not include local anesthesia or major regional anesthesia.
Now that we've completed the definitions of sedation and anesthesia, I think it's time to turn our focus to an actual sedating event and the steps that we go through from beginning to end to care for a patient.